Hey, Facebook fans, this is Rita Batchley, and this is Coffee with Nurse's Nurse. It's good to be here live with friends and family of nurses and friends of nurses. Doing these live streams to get to know you guys, see where you're at, and to post live because there's nothing like live TV. And this is Rita Batchley, the Nurse's Nurse. Coffee with the Nurse's Nurse for friends and family of nurses. Today's subject is, what is the Safe Staffing Act and where is it? Well, first off, I'm glad everybody's here. A lot of our past weeks, we've been covering some topics on self-care and how to prevent PTSD or deal with PTSD and stress and trauma, COVID, everything that's going on in the nursing world, because it's tough out there. It's been tough for a lot of people, and nurses have been hit really hard. So first off, I'd like to say what safe staffing isn't. What's going on right now with a lot of nurses is they're hitting a wall with the staffing issues at hospitals. They're asking for help. They're being told that there are no nurses, and more and more patients are showing up. So what's happening is the nurses are being shamed and blamed for the very crisis that they're trying to prevent. They go in and do the best they can, but there's only so much one nurse can do when they're in an emergency situation. And safe staffing has been around for a long time. The issues regarding how many patients can a nurse safely take care of. Well, becoming a nurse is really hard, and it takes a lot of schooling. And every shift, a nurse is supposed to do, or at least every 24 hours, an RN is supposed to do a head-to-toe assessment on a patient. And based on how sick that patient is, the nurse is supposed to be able to have input into how many patients she can handle that day. But it doesn't seem that hospitals are staffed that way. At least that's not how it was for me. And there's a term called gaslighting. I know it's kind of, well, it was new to me when I heard that term at first, gaslighting. What the hell is What the heck is gaslighting? And it's when it comes from an old movie where this man was trying to make his wife or girlfriend think that she was crazy. And every time she would complain about the lights in the house or the apartment were low or bright or too high, he would say, no, they're not, they're fine. And that's what's going on in hospitals all over the country, that nurses are screaming and yelling that they don't have enough help. And their administrators, managers, and hospitals are saying, no, that's not true. It's fine. You can handle this. You're strong. You're caring. You're great. And so it puts this like shame and blame on the nurse in charge of the patients. And day in and day out, that causes a lot of stress, and it's like insanity for nurses because we think that it's normal after a while, like showing up to take care of so many patients is like normal and it's not superhuman, when in fact it is above and beyond what any human being can possibly do. So I did talk about this pathway to excellence and this framework for PTSD. I don't know if you can see that. It's from the American Nurses Association, and it's in this journal. benefit. Yeah, this is the latest January issue of the American Nurses. And what I notice is they go through everything to help nurses, and there's some really good ideas in here. But what they don't cover is in shared governance, because that's one of the things that nurses ask for all the time. They want input into how patients are being handled by nurses or treated, or there's AKA staffing. And this article does not cover that at all. And in fact, every time I looked into ANA, American Nurses Association data, or it seems to me that their answer is to become a master's degree nurse, leave bedside nursing, become a teacher, an administrator, or a manager. And that's just not what most nurses want or can do. Because honestly, really making a difference in a person's life on a day-to-day basis. Like, I was a labor and delivery nurse, and there was nothing like that feeling of empowering women and being part of a family experience. And it was beautiful, and it was difficult, and it was hard, and it was sometimes brutal, but it was like this really intimate experience. And being a bedside nurse, you do that. You're like right there with the patient, like being there for them. So today I have a special treat for all you friends of nurses and nurses out there. And this is a little short video put out by the New York Times, and I'm going to show it right now. 6 minutes long. Hope you can stick around afterwards, because we're going to talk a little bit more. But this is...
You know, they call you an asshole.
Been called a bitch 1,000 times.
A cunt, a knocked up whore. Get the F out of his effing room, you effing N-word. I've been bitten,
Choked, punched in the mouth.
I had a guy try to kick me in my stomach while I was pregnant.
That poor nurse at your bedside has probably been through hell with the last 10 or 15 hours, and then you come in demanding ESPN? Are you kidding me?
And it's like, well, yeah, I got punched in the head tonight. And any other job would be like, what are you talking about?
2 years into the pandemic, COVID is surging. America's frontline nurses are overworked, burnt out, and quitting in droves.
The H is for hospital, not hotel. Treat me with respect.
As Omicron pushes hospitals to the brink, America is facing a national nursing shortage. But it's not patient abuse that is ultimately driving the crisis.
I literally don't even want to be a nurse anymore. Like, this shit f***ing sucks.
It's not emotional trauma.
I hate my job, and I don't want to go back.
It's not even COVID.
I cannot do this anymore.
The biggest force that's driving nurses away? Greedy hospitals.
I could no longer work in critical care under the conditions I was being forced to work under with poor staffing, and that's when I left.
To maximize profits, American hospitals have been intentionally understaffing nurses for decades, long before the pandemic. What the hospital industry doesn't want you to know is that there's never been more licensed nurses in America. Hospitals just aren't hiring them.
There's not a shortage of nurses. There's just a shortage of nurses willing to work under those conditions.
If you don't have enough nurses, patients will die. They will become sicker and they will die.
If you're in the hospital, your chances of dying go up by 7% for every additional patient your nurse has to care for.
If you push me past my limit, past my capacity of being able to multitask, something's going to get missed. And when I say something, I'm talking about your mother. I'm talking about your father. I'm talking about your husband and your wife.
There have been many instances where patients that die that shouldn't have died. I know that unequivocally. Families, they feel like you've done the best job that you can. And the reality is we're not. I could not get into her room for over 2 hours. When I did get into the room, she had tears in her eyes. She was crying and holding on to me. And when I looked in her bed, she was soiled in urine.
I felt like I did a bad job. I felt less than the nurse that I know I am. And I started to cry all the way home. Can I make another shift? Can I do this again tomorrow, get in my car and drive here and do this again?
The system was already broken. COVID has just made it way worse.
In one 12-hour shift, we had 6 patients die under the age of 50. And as quickly as they got those beds cleaned, there was more patients there.
A patient grabbed my hand and he begged me to not let him die. Sorry. And I told him that we would do everything we could within our power. And I felt like I was ready to fall apart, but I couldn't because the patient in the next room needed me.
To understand how the situation became so desperate, you have to remember that hospitals are just like any other business. Staffing takes up about half the budget, so a smaller workforce means bigger profits.
Hospitals use this type of what they call flex staffing. So they flex for just the bare minimum at that hour of the day. And then 3 hours goes by, there's many more patients, and then it's, well, you have this many nurses, you'll have to just make do.
The most annoying thing that was ever said to me in my career by an administrator was, "We know you guys need nurses, but it's not in the budget."
The situation is dire. More than 40% of nurses are thinking of leaving the profession.
I hope to be able to leave the bedside within this year.
I don't know how long I can do this. Physically, mentally, emotionally.
I will never work in a hospital setting again. I will never subject myself to that sort of frustration, and I will never be part of what's being done to patients in a hospital that way.
Focusing on pandemic burnout lets hospitals off the hook. We should be talking about better nurse-to-patient ratios, which would save lives.
There really needs to be a systemic change from a legislative standpoint.
Why wouldn't you limit the number of patients, human lives that nurses hold in their hands every day to a certain amount that's safe?
The solution is simple. Pass common sense laws that limit the number of patients for each nurse. Pennsylvania and Illinois both have bills pending that would do just that. But a similar law in Massachusetts failed to pass in 2018, thanks in part to a $25 million campaign by the hospital lobby.
It puts government in charge of deciding how nurses care for patients with the same rigid staffing ratios at every hospital in our state. A one-size-fits-all attempt to override the professional judgment of nurses.
The problem with these ads? They're misleading. Just look at California, where a bill like this did pass. The result? More nurses hired, more nurses staying in their jobs, and better patient outcomes. This is a national emergency, but one created by the hospital industry, not the pandemic. We need to save lives, not profits.
It's my biggest fear, is to miss something that hurts someone. Because I'm not there to hurt, I'm there to help. And we need more help.
Wow, what a great little short clip that was, and what an honor and a privilege to share it with my fellow nurses and friends of nurses who've been tuning in and listening to Rita Batchley and Coffee with the Nurse's Nurse. I saw that clip about a week ago, and I was just blown away, because it just really answered to this insanity that I was feeling, all these years when, we were asking for help and needing staffing ratios, and we were told that just to make do, and that we were whining, and what's the problem? And it was just turned back on the nurses, like it was our fault. And it even feels like that now, like these issues that are coming up with the pandemic and stress and PTSD and burnout, that it puts it back, the responsibility on the nurses to get help. And a lot of that is true. Like, I have to take care of myself and I am responsible for my own happiness. But there's also accountability with hospitals, and they're not being held accountable. Any nurse who's ever gone through a Joint Commission accreditation survey knows that they don't look at the staffing. And it's like, that's the number one thing that really concerns nurses is, how am I going to do my job and take care of so many patients at the same time? Because sometimes, honestly, these ratios are, they're the minimum of what a nurse is, one nurse to, 2 critical patients, or one nurse to 4 emergency department nurse patients. Sometimes if a patient is, in the midst of a respiratory arrest, you need more than one nurse. You need 4 nurses. So it's not a one size fits all. And but the minimum standards need to be there, because hospitals are not being accountable. And how can hospitals be accountable? By making it hurt for them not to follow these rules. They would lose their accreditation. They would lose their ability to bill Medicare and Medicaid and insurance companies, and they would not be able to charge patients for care, basically because they're not getting the care that they need. And nurses have been saying this. So what is the Nurse Staffing Act? It's called the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act. And it's in Congress right now in the 21 to 22 session, 2022 session of Congress. And it was put out by a Democrat from Ohio. And it's out there as a federal bill that would set up safety limits. So it would, those safety limits being the number of patients an RN can safely care for in hospitals across the United States. And that would be huge, because right now, the way that it's set up, we're basically at the mercy. And I really was like taken back to hear the nurses cursing in the beginning of the clip that I just showed. And the name of that clip, by the way, was Hospital Greed is Destroying Our Nurses. Here's Why. And those nurses, say, just repeating the names that they had been called by their patients. And, it's really got, in the 30 years that I've been a nurse, we never had patients. Well, I would have patients occasionally act out or throw like push a phone, or not cell phone. This is like dating me, because this is like a regular phone, hospital phone. They threw a phone at me once, or they called me names. But today, assaults on nurses is almost like a daily occurrence, especially in the emergency department, where the waits to be seen by a doctor can be upwards of 8, 16, 24 hours in some hospitals, which is like totally insane. And I'm just glad you guys could tune in and listen up, because this is going out there live on my Facebook feed, but it's also going to be on my YouTube channel. And I'm going to also put it out there on my Facebook Nurses Nurse group. So if you're not subscribed to my Nurses Nurse, I put the little ticker on the bottom. So you could go to my website. You can check out my book on Amazon.com, or you could go to my Facebook page and join that as well to continue the discussion of what's going on with nurses today and what we could do to save lives, because safe staffing saves lives. There are studies that have been done, and it shows that when a nurse has even one extra patient over, when she gets overwhelmed or multitasking, the chances of an event, a life-threatening event occurring that she misses or just, goes up 7% for every time that a nurse is overwhelmed like that. So having enough nurses at the bedside does save lives. And where do we have safe staffing acts right now? Well, we have them in California. There are nurse to patient ratios in California that were passed in 1999. I was part of that. It was a big struggle and a big fight. It wasn't something that was given to the nurses like, oh, this is the right thing to do. As you saw in the video clip, the state of Massachusetts paid $25 million to have the Safe Staffing Act defeated in 2000, I think they said 18 or 19. $25 million they spent. So you know that if they spent that much to defeat a bill that would help nurses or to put more nurses at the bedside, you know that they saved money in the long run. And that's what was driving it, money and greed. And that just kind of sickens me. I know like socialized medicine is not like something anyone wants to hear about or fight about, and that's not what this discussion is about. But as long as hospitals are for profit, solely for profit, it appears, that it's difficult to meet the higher laws of compassion and having enough nurses at the bedside. I worked at a public sector hospital, which was a nonprofit, truly nonprofit. A lot of hospitals say they're nonprofit, but they definitely have a board and stockholders, shareholders that they're answering to. I worked for the Ventura County hospital system, and they had a teaching program, and they could not spend public funds on advertising, all this kind of stuff. That the money that was brought in by the hospital went back into the hospital and back into serving people that can't afford to be taken care of. So California is the only state right now, but also on the state level, there are nurse practice acts that do address staffing ratios. And I know some hospitals have critical care staffing ratios. But when I found out that Florida didn't have a staffing ratio in their ICU, it just blew my mind. Like, really? How does a nurse take care of more than two critically ill patients? And I was told, that, you could have 4, 5 critically ill patients. And that's just insanity as far as I'm concerned. And what in California right now, we have 4 med-surg patients to 1 RN. It's 2 active labor patients to 1 RN. And when a labor patient is, in the final stages of ready to deliver, it's 1-to-1, which is really 2-to-1 because you have a baby on board and that baby is still the patient. So, that would help a lot, because nurses have been saying this for years, that we can't take care of that many patients with not enough help. If you figure that when you go on an airplane, they have to have enough staff on the airplane in order for the plane to fly safely. So during, I think a couple of weeks ago, a lot of flights got canceled because the staff was sick with COVID and they couldn't staff the airplanes with enough support. So how could they do that in a hospital where they keep running a hospital? Now, I'm not an advocate for closing hospitals. That's not what I'm saying. But what I am saying, according to that video, there are more licensed, registered nurses in this country than ever before. but they're not working at the hospitals and at the bedside. And the reason is because a lot of them just can't take the stress anymore. And it's no matter how much we try to take care of ourselves. I mean, I don't think a bubble bath is going to help anyone in this circumstance when it comes to saving, the fact when you lose a patient or even have a patient go through that humiliating experience of calling for help and no one being able to get to them, it just leaves a mark on you. And over and over again, the nurse just gets broken down by this feeling of shame, and that the system and that we're to blame for this problem, and we're not. So to hit the hospitals where it hurts and fining them for not staffing appropriately and for loss of accreditation is something that would definitely make a difference. I know it did in California, and it took the law in California, AB 394, it passed in 1999, and it took like 8 years to come up with the ratios. I went down to the Department of Health and Safety, the DHS, and they interviewed all kinds of nurses on how many patients they could take care of and what would be, and they came up with a way to do it. And what I think it's brilliant. It's based on the RN's assessment. So it's the flexibility in the law is that as a licensed RN, I go in and do an assessment. If a patient is sitting waiting to be discharged and everything's been done to them, they're still in that bed waiting for their ride or whatever, then that patient, doesn't count like another patient would count, as far as a nurse could help take care of another patient. But the problem too is that nurses don't speak up and say what they're needing. But I think more and more nurses are doing that. And leave a comment or a note in the comments. Come visit me on my website at thenursesnurse.com, or join me on my Facebook, The Nurse's Nurse, and come back next week. We'll be back to discuss more on self-care for the RN or nurse or anyone else who's needing to know how to take better care of themselves, because you cannot give away something you don't got. And if you don't love yourself and take care of yourself like you love yourself, you can't give that stuff away. And I am the Nurse's Nurse, signing out. Oh, coffee with the Nurse's Nurse.